Hello, I'm Dr. Winteregg from MGE, and today's tip of the week is the final video in our series on the new patient experience. So we've greeted the patient has met the doctor, and now it's time to do the exam. And it's typical to sit down. The way I used to do an exam is you lean the patient back, and tooth number 1 needs to be extracted, and we need to do a root canal number 3, and this tooth needs a crown, and we need an oral surgery consultation. And one day, I realized this was probably the reason some patients weren't coming back, is because I was using scary terms during the exam. So I had to confront that I may be the one causing these people to not return. So I changed my exam to just using numbers and letters. And I would explain to the patient, before I lean you back today, my assistant and I have a system of shorthand. I'm just going to use numbers and letters. It kind of makes things go a little bit faster. Now, I will tell you that before I do any procedure, I'm going to give you all of your options, explain exactly what's going on and how much this is going to cost. And then I would lean them back. If tooth number 3 needed to be extracted, I said EXT. If tooth number 4 needed a root canal, I would say RCT. A crown was CR. An oral surgery consult was OS, implant IMP. And so what I wanted to do was 1, 2, 3, ABC, XYZ my way all around the mouth. And at that moment, I didn't want them to have any idea what they needed, because I may not have enough time to do the consultation that day if the case is going to be more involved. The ideal is to sit the patient up, have enough time, tell them what they need, do the consult right then, but there may not be enough time, and it depends on how your office is organized. So my main tip for you on the exam, do not use any dental words that they could even remotely understand. Now, when you sit down to do the consultation, obviously now you're going to explain they need a root canal, they need to see the oral surgeon, or etc. But for me, that changed everything, and now it was more predictable that the patients were going to be returning for their treatment because I wasn't scaring them at the exam. And that's my final tip on the new patient experience.